Welcome everyone to our webinar, New State Regulations Mandate ONC Certification, How to Know If Your Software is Affected. My name is Lynn and I'm the Field Marketing Manager here at Drummond. Now I'd like to introduce you to today's speakers. Sonia Galvin, Senior Director of Health IT Testing and Certification at Drummond, and Bob Bryan, Senior Director of Health Advisory Services at Drummond. I'm going to pass it over to the presenters now.
All right, thank you, Lynn. And thank you everyone for joining us today. So if we can take a look at the agenda. Thanks, Bob. So first of all, we're going to discuss how states are enacting legislations that we feel developers should be aware of in order to help providers and hospitals meet some new state level requirements. Also, we'll review some key state examples and how they're establishing frameworks for health information exchange. And then take a look at some trends in interoperability that we're seeing, also HIEs and AI and how they intersect with the ONC and CMS Health IT mandates. And then lastly, we'll discuss how Drummond, as a steward in the ONC Certification program, can assist you with navigating through these requirements. Next slide, please. So Drummond has been seeing an increase in developers requesting ONC certification due to state health regulations. So we wanted to raise awareness of the regulatory scope expansion that we're seeing. We know regulations are empowering states to use technology, not just for compliance, but also as a strategic tool for transformation, equitable health outcomes. In many states, especially those tied to Medicaid programs or public health reporting, they do base requirements on standards set forth as part of the ASTP ONC Health Certification program. For example, states are working to ensure interoperability and exchange of patient data across organizations and care settings, encouraging participation in the HIEs and national networks like TEFCA. We see them developing policies to promote FHIR, API-driven standards, also to reduce reporting overlap. Some examples of some maybe more mature networks or states such as Minnesota, Delaware, Utah, where they formally included things like USCDI and social determinants of health elements in their participation criteria. States are also boosting broader interoperability, creating a foundation for electronic prior authorization. As an example, Texas, their Health and Human Services, they heavily invest in statewide HIE infrastructure, enabling secure integration of EHRs, payer data information. Kansas and Washington also introduced legislation around EPA. So we do expect to see new ONC criteria soon for EPA or electronic prior authorization in order to align with the CMS MIPS measure that we know are in place for 2027. So new criteria to come. Also, there are several factors combined to drive better health equity and outcomes. States are incorporating ONC's frameworks, such as the patient-generated health data. So those principles help promote patient access, transparency, equity. As an example, Ohio and Florida. So they've embedded some of the PGHD rules in Section 1115 waivers, telehealth expansion programs, and requiring systems to ingest that remote patient data into clinical workflows. Also, we see incorporation of health equity by design. Those guidelines are embedding patient access and collection of data elements, again, such as the social determinants of health. And then, of course, USCDI as a baseline for required data elements in EHRs and social care platforms. As part of the ONC standards, USCDI version 3 includes elements such as race, ethnicity, sexual orientation, gender identity. By embedding those requirements in law and Medicaid contracts, states are turning health IT really into a strategic tool for them, for care transformation, system efficiency. And so by use of these robust data systems, providers are able to track disparities, stratify outcomes, and personalize interventions. Some examples of that are North Carolina Medicaid. They use SCOH data to route patients to community-based organizations, perhaps for food or housing assistance through their NC Care 360 platform. States have unique population needs, and so with those diverse populations, we see that the SDOH data digital access challenges, things like that, where federal rules may have often generalized standards. We see that the state health regulations can really tailor those expectations to match their local needs. Also, with the state level health IT regulations may help funding and grant eligibility, creating a baseline of readiness that allows healthcare entities to qualify for federal funding. And I'm sorry, can we go back one slide? Thank you. And so, sorry, one more. There we go. Thank you. So mentioning qualify for funding, for example, state mandates, EPA or USCDI aligned data exchange may enable providers and payers to apply for CMS innovation grants, just be more competitive for CDC, ONC, and CMS grants as a whole. Also preparing providers for TEFCA and future federal standards. So states are proactively preparing their ecosystems to plug into TEFCA as it becomes more functional national health exchange framework. So this aligns with efforts to improve their public health and care coordination. And so as we know, the ASTP ONC requires USCDI version 3 for certified EHRs by January 2026. So states are aligning early to ensure that providers are future-proof and they meet those expectations for TEFCA. As an example, we have Iowa. There's a bill currently under consideration to push providers and payers towards the state HIE or TEFCA networks. There's a consideration to require TEFCA rather than just building separate HDUs. Reducing cost and burden is being weighed within that bill, so we'll certainly keep an eye on that one. Next slide, please. So we're going to just touch on the importance of electronic health information exchange and state IEs just briefly. So we do see, as many of us know, the state requirements have a strong focus around interoperability. The state HIEs are actively encouraged and strategically positioned to participate in TEFCA. And that enables just better care coordination, improved outcomes, patient empowerment, and this supports broader public health. The requirements to participate do align with the ONC standards. And as we know, for the role of ONC certification, the ASTP ONC sets those baseline standards that states use or perhaps that they build upon. And the state regulations mandating EHR adoption that we've come across, not all specify which criteria to certify to, but rather just focuses generally on interoperability functionality, just enabling data sharing, systems to exchange. So we know that's what we want to focus on and what developers need to comply with. So as part of the ONC-based EHR definition, developers are encouraged to meet requirements to demonstrate the capacity to exchange EHI, such as your transition of care and your API criteria. So on the next slide, we'll go ahead and pass over to Bob. So Bob, you can share information regarding the ONC CMS regulations that are impacting state interests.
Yeah, I think you've touched on a number of these. One of the key things to understand is that the ONC program sets a bunch of different standards around data sharing and handling of data, specifically the USCDI, which sets the core data set that is needed for sharing, and then a couple of different interoperability approaches, FHIR being the newest, which is a RESTful API that things like smart apps can connect to, make calls for specific data, as well as the older clinical document architecture or CCDA approach, which has specific formats and data requirements for documents that get transferred. And all of that really supports the HIE connectivity that you were talking about, Sonia, because having standards in place allows systems to talk to each other. And the states have had much more focus on developing their own HIEs. And those health information exchanges are increasingly being required in different ways through different state programs. The ability to do connectivity comes up in RFPs that are issued at different levels, state and local government. We've even seen them from schools. And then in the area of public health reporting also, we see the need for data to be transferred between private provider entities and state entities. And that comes up in areas like immunizations and syndromic surveillance, arising out of COVID a few years ago, and a variety of just general electronic case reporting requirements, for which, again, there's a standard for electronic case reporting that's set in the federal program. So when these state laws talk about being certified, systems being certified, whether it's required in a law or regulation or comes up in an RFP, they may not specifically say what it means to be certified or how fully certified, because we know the certification program contains dozens of different criteria, but that core set of base EHR criteria that primarily supports interoperability typically is what is being required or needed when states are saying that systems should be certified. And then we'll get in a little more into some other more specific areas like AI regulation that's coming up. And again, AI supporting healthcare decision-making is an area where there's an ONC criterion, the B11 criterion. And some of the things that states are wanting to do cross over with the functionality that is required for the federal level ONC certification. And a last area really is the ability of patients to request restrictions on their data, which is coming up also. ONC has a requirement that's due at the end of this year for systems to have a request process that patients can use. And we'll talk a little bit more about the direction of some of those state laws, which are to some extent taking the starting point that ONC has created with the request process under E1, and then moving beyond that with some more specific requirements on supporting the restriction of the transfer of patient data when patients make those types of requests. It's also important to understand that what states are doing today is part of a longer-term trend that's been built up by the ASTP ONC program. And what's happened is that over the last 15 years, from the early days of certification, we've built up this capability in systems to be interoperable. And what this graph is showing, and I think this was a study by the American Hospital Association that was published by the ONC, hospitals are at the point where over 95% of patient records are managed in certified systems. So all those systems are able to transfer and receive patient documents in the industry standard formats that have been adopted in the ONC program. And at the clinic or ambulatory level, it's a little bit lower. It's about 80% now, and this was data as of 2021. So it's probably gone up a little bit since then. But again, these trends show kind of where we are today with healthcare systems and their ability to operate under these standards, which are the linchpin to enabling interoperability and enabling the growth of health information exchanges and these sort of next phase policies that states are getting involved in. So why don't let's move into actually some of the specific state requirements now. And I know one of the biggest ones that's come up that you've been looking at, Sonia, is this AB7 requirement in Nevada. Do you want to talk a little bit more about this?
Yeah, absolutely. So for Nevada, AB7, it was enacted in 2023. It established a comprehensive statewide framework. It mandates EHR interoperability, patient access, and structured EHI. So all healthcare providers and medical facilities that are licensed to operate in Nevada must be able to transmit and exchange health information in accordance with the state law and health regulations. So this affects all Nevada licensed providers, medical facilities, and insurers, regardless of the payer source. So to clarify, it's not just limited to Medicaid providers. There are 2 compliance options for healthcare providers, and these align with the federal best practices for interoperability, which is to have a compliant EHR, which is certified under the ONC program. An ONC certification is explicitly named, or to participate with a compliant HIE that is a member of TEFCA. And the rationale for those 2 options is that they enable the patient's direct access to their health records electronically, and also the ability to forward those electronically at their discretion. So while the ONC certification functionality is a requirement, specific criteria aren't explicitly named, but we are encouraging developers to focus again on those national standards. So things like the CCDA, FHIR, even patient portal functions. And additionally, the ONC-based EHR definition identifies some specific criteria that it helps EHRs have capabilities to exchange EHI. There's also
and I would comment here that while it gives the 2 options of having a certified system or participating with an HIE, you don't magically participate with an HIE without complying with standards. And the standards are what you comply with when you get certified. The standards like USCDI or CCDA and FHIR. So really, ultimately, to securely exchange your data, whether you're going through an HIE or whether you're exchanging it with a patient or another provider directly, it all comes down to compliance with the standards. And that, I think, is why, while the law says you should be certified under the ONC program and doesn't specifically say which criteria, it goes on to say that you need to be able to securely exchange, integrate, or cooperatively use electronic health information, and that you need to adhere to nationally recognized best practices. And nationally recognized best practices, just to go back 1 slide quickly, it's this. It's these certified systems, over 80% across the country and 95% of hospitals, that are complying with the industry standards, HL7 standards, that were incorporated into the federal program for certification. So really, all of this stuff works hand in glove, but it comes back to these standards that have been built for interoperability. They happen to have been incorporated into a federal program. They've now been widely adopted nationwide. And then following those standards takes us into this new phase, which allows the kind of work through health information exchanges that's been growing over the last few years.
Yeah, thank you. Now, starting with the deadlines. So deadlines were set forth in the Nevada regulation. So July 1st, 2024, so about a year ago, hospitals and physician groups with more than 20 employees had to comply. January 1st, 2030. So that's for physician groups with 20 or fewer employees or solo practitioners have to comply. And then July 1st, 2025, which just passed, that deadline was for all other healthcare providers. And this included a long list of healthcare providers such as physical therapists, pharmacists, psychologists, behavioral analysts. And so for this regulation, there is enforcement. So for provider or medical facility is found to be non-compliant, corrective action or administrative penalty might be imposed. And also they're really expanding the legal protections, extending civil and criminal immunity to providers who use HIE and compliant EHRs with standards. The bill also allocates grants to help small providers and facilities purchase or implement compliant EHR. So in Nevada, this particular bill really sets a bold, uniform interoperability standard. So mandating EHR use, mandating the exchange across a full spectrum of their healthcare providers, embedding patient access. So we're really looking forward to seeing what more comes of that. Next slide, please.
And I guess because, as you mentioned, small practices have a deadline that's about 5 years out. but everyone else is subject to the deadline this year. Hopefully, that's mostly players that are within that 80 to 95% range that are already compliant with the ONC program. But it could be that many systems that support that smaller provider group aren't compliant today, but will need to be moving towards compliance over the next 5 years.
Absolutely. Yeah. Thanks, Bob. So we'll take a look at another key state example. So New Jersey, their Assembly Bill 4594. So this actually began with a statute that was enacted back in 2020. And it was in response to COVID-19. And at that time, long-term care facilities were required to adopt ONC certified EHRs, support interoperability, also to connect to New Jersey's health information network. There were grants that were authorized for EHR adoption. And so it focused narrowly on that adoption and interoperability standards. So this particular bill, AB 4594, it was an amendment. And actually it is still in it's proposed legislation. And it's a standalone bill. It amends, but also expands the statute. It adds new technology requirements and such as adding telehealth coverage provisions, mandates additional capabilities for long-term care facilities, but it also expands to include home and community-based care services, those types of providers. So it's a statewide technology assessment as well, an action plan. So once it is enacted, this particular amendment, the long-term care facilities and the home care-based providers, they are required to comply within 270 days from enactment. And they are expanding grant eligibility as well to fund the EHR implementation. So again, another change that we're looking forward to, just another example of regulation. It doesn't state which ONC criteria to certify, but again, just talking about the continuity of care, discharge documents, things like that leads to the need for interoperability functions.
Yeah, those things, when they cite things like CCD, that's specifically in an ONC criterion that you would certify to, the B1 criterion, and the standards that are behind that are specifically referenced in those rules. So it's again an area where this operates hand in glove with the ONC program.
Right, absolutely.
And I know there are a number of other states that are doing different things with HIEs. And you talked earlier about the growth of requirements and support and incentives for participation in health insurance or health information exchange, including the TEFCA program at the federal level, which is support of or promoting the use of qualified health information networks, or QHINs. You want to talk a little bit more about some of the states here that do have movement going on around promoting the use of HIEs?
Yeah, so as an example, in California, the data exchange framework, again, encouraging interoperability, but doesn't specify any, that particular one doesn't specify ONC certification. Also Minnesota, that was a mandate, but at this time, I believe that one was repealed, but it is promoting voluntary alignment. But there are other states mandating HIE participation, such as Florida, North Carolina, Maryland, New Jersey, as we mentioned, and others.
Yeah, and the key thing, while these laws are not directly stating that ONC certification is a requirement, it's again a situation where effective data exchange, particularly with the systems that are already certified, the 95% of hospitals, they're going to be exchanging data in accordance with the HL7 standards that are part of the certification program. So it's sort of at a point where there's a critical mass for these certified functions, and if systems don't have the certified functions, it's going to be very difficult for them to participate in the type of data exchange that occurs through these health information exchanges.
Right. And I also wanted to just touch on here, I think you had touched on the school districts. So we actually were hearing from developers regarding certification requirements that are coming up for some school districts. We looked into some RFIs for like Vermont, San Diego County, Chicago. So we know those health services, they do exist in schools, but there just wasn't a lot of evidence yet of any finalized regulation. But best practice to have the systems in place for health information exchange and Medicaid billing. So we'll continue looking on that front, but just thought that was an interesting point to look out.
Yeah, and I think it goes, you and I talk to a lot of different developers that are at different places in terms of their development of EHRs, and it just seems like it's becoming so common that we hear that they have an RFP that's asking them to, as an RFP requirement to have certified technology. And maybe that's because, 80 to 95% of these systems across the US are certified. It's just an expectation. But I think it also comes from a mix of different state laws. There are the Medicaid laws that were providing incentives up to about 2019 that helped create a lot of the adoption. The incentives expired, but many of the laws, I think, are still in place, which means that these requirements go into RFPs. If an RFP is being issued by a school district as a state government entity, they'll include those types of requirements. And then as we see more on the HIE front, I think that's kind of the next phase of state push for these standards-based approaches which come from certification to be used.
Yeah, absolutely.
Just moving into a separate topic, we mentioned the area of AI, and in the ONC world, in certification, the term that's commonly used is predictive decision support interventions, which encompasses a range of systems that use artificial intelligence and machine learning. The first step that was taken at the ONC certification level was to require that certified EHRs who release AI or machine learning based decision support, that they do really two things that are essentially disclosures. One is to provide a set of information that the ONC calls source attributes. And the best way to think of this is it's explainability information and it's transparency to end users about what the AI is doing and what it's intended to provide. So what's the intended patient population? What are the intended purposes of the AI? How should it be used? What are the risks of using it? What are the cautions of using it? It's the type of stuff that I always think of it as the type of things that you see on a drug package insert are what these source attributes are. They're intended to explain what the AI solution is doing so that providers can understand it and trust it. And then the second thing that the ONC program requires is some specific disclosure about the risk management program that's being used on an ongoing basis. Because we know there's a need to not just assess risks up front when it comes to AI, but continue to monitor what the AI is doing, particularly if it's involved in critical healthcare decisions. So that's what the ONC did. It was really just a first step to require better information being provided to the clinicians who are end users of these solutions. But the interesting thing is that what the ONC did is well aligned with regulation that's coming out in states. Particularly Colorado, I think they're the most notable state that has passed some legislation that they actually reference the ONC program in their law. And they say if you comply with the federal level program, that's sufficient for meeting the requirements of our law. And they also refer to following industry standards, which these types of disclosures are becoming industry standard. California has somewhat similar, but not quite as comprehensive as Colorado. And Utah has gone into this space, as have some other states coming at it from different directions. Other key note here is that the EU AI Act and many of our EHR customers are operating in other geographies like the European Union. Much stricter requirements there, but at the core of their requirements also is having a risk management program in place, recognizing that healthcare is an area where critical decisions can be made by AI. So disclose information to your end users about the intended purposes and caution and risks, and then also continue to manage and govern good risk management practices.
I believe also California is, I believe they may have referenced the ONC standard as well. So it's good to know. So if developers and products are certified at ONC, that they might have some exemptions at the state level.
Yeah, that's great. Yeah, it really is it's a good alignment so far, even though there are concerns about us having this sort of mixed system with laws, AI laws in a lot of different states. At least as it comes to healthcare at this point, ONC set a good standard by essentially requiring a set of good disclosures to the users of these systems so that they can understand and trust them. And that's actually, just briefly, I'll mention one of the reasons we built a separate certification program that's based on the subset of requirements in the B11 rule that require these disclosures we've been talking about. There are some other requirements that apply to EHRs in B11 to enable the integration of AI, but independent AI developers, and there's a lot of them out there in healthcare right now, don't build systems that can comply to the full B11 rule. But they can meet these disclosure requirements for source attributes and for explaining their risk management program that EHRs are following now. So we built a separate program called pDSI-Risk certification that enables those independent developers also to get up to the same level that EHRs are at. And I know that comes up with your team, Sonia, in terms of EHRs that are choosing to partner with or adopt third-party solutions to incorporate them into their EHRs.
Right, so there's an opportunity for developers to encourage their API partners to certify to this, so just to provide some assurance and potentially mitigate risk.
Yeah, it's difficult for the EHR because if you partner with an AI developer, you're not the one that's deep in assessing the risks of that solution because you're not building it. It's being built by your partner. So we see a need for independent AI developers that want to partner with the EHRs to really come up to this standard, because as soon as they partner, it puts a responsibility under the ONC B11 program or certification, responsibility on the EHR to make sure that those disclosures are being done. Last topic we can briefly touch on, because it is an important area where there are some state law changes arising, has to do with patients' rights to request restrictions on access to their data. This has been a right that has existed in HIPAA for some time. But it hasn't been part of the ONC program from the perspective of requiring any specific functions in software. But when the HTI-1 rule came out a couple years ago, there was an addition to the E1 rule, which we think of primarily as the rule that governs patient portal functionality, and the ONC added a requirement for the software to be able to enable patients to initiate a request, to submit a request for a restriction on their data. Doesn't say anything about how that request should be handled. HIPAA still provides guidance to providers on what they need to do, but this just took a step from the ONC side to get a request process into EHR systems. But what's been happening now is that states have been going beyond that, particularly in areas like reproductive health and to some extent in mental and behavioral health areas where there is some more sensitive data and that patients may more commonly want to have restrictions on the transfer of that data. There are some requirements coming up in California, Maryland, and Washington. There's some data segregation requirements that are coming from these states. So that's downstream from the request that the patient makes to restrict my data, because patient isn't going to say how to do it. But California is specifically requiring some actual technology in EHR systems, as is Maryland. And Washington has taken a sort of a broader approach, allowing some deletion rights to patients for certain types of data, and actually extending beyond some HIPAA data to some other related health data that gets, that basically ends up in other systems as well as EHRs. So an interesting area to watch. Because of these state laws, it is already affecting something that EHRs need to build into their systems. And at least as of the end of this year, for those that are participating in the ONC program under the E1 criterion, they will have made a good start with the request process that's required there.
Right. All right. Well, thank you, Bob, for that part. And so just to wrap things up in terms of how we, your partner in compliance here at Drummond, can assist you. So Bob talked a bit about the pDSI program. So we have developed that certification program just aimed at third-party API products. Again, just to provide some assurance, mitigate risk, and also assisting in monitoring state regulations. So Drummond can help make sure you're understanding those requirements as we continue to explore and monitor those regulations, just to help you stay updated. We have a team of experts here to help you navigate these requirements, whether it is at the state or federal level. And then, of course, just our testing and certification services. We want to make sure to help ensure your product meets the interoperability standards and maintain compliance with new requirements. And last slide, just some takeaways here. So just to wrap things up, laws, as we can see, they are beginning to require risk assessments when it comes to AI. We see things tied to interoperability, patient privacy. And so while state laws, they're not uniformed, but the trend is clear. Certification is a base for helping reach some of those goals nationwide. And so it's important also for health IT products to align with the ONC standards to help ensure compliance with state or federal regulations. And then we do see that states, they're no longer waiting on federal rulemaking. They're defining those local ecosystems, implementing real deadlines, also funding mechanisms, and enforceable patient rights. So they really are shaping how those systems exchange data, and how they integrate with emerging technologies like AI and with machine learning, clinical decision support. So really exciting to see the movement in that space. And for our last slide, I think we're now at our time for Q&A. But I did want to mention here that Drummond has a decision tool. There's a QR code on your screen. That is for any developer maybe new to the ONC program, wants to understand if they are eligible to certify and if they're required in terms of some of the state regulations that we reviewed today. So a nifty tool for new developers if you're interested. Also, we'll be sure to, anyone who's interested in some of the information we went over with specific state data, we are welcome to share that with you. So welcome to reach out to us. All right.
Well, it looks like we have a few questions here. One of them I see is, can you clarify how the ONC base EHR definition impacts state requirements? And I'll take a crack at that, Sonia, and you can chime in.
Sure.
So the ONC base EHR definition is a definition of a specific subset of the total criteria in the ONC program. And they're the primary requirements when a provider has to tell CMS that they're using certified technology. They need to have that set of functions that's in the base EHR definition. The interoperability criteria that are in the definition, which I think of, primarily as B1, B2, E1, and probably B10, and a couple of others related that are the core interoperability requirements. G10, I should mention, which is the FHIR one also. Typically, having those interoperability functions are what these state requirements are asking for. At least that's what the laws seem to imply, because they're basically saying you need to be able to securely exchange data under the Nevada law, for instance. So you can't securely exchange data in accordance with national best practices unless you have those specific interoperability functions. There are some other sort of related but not direct interoperability requirements that are in the base EHR definition that might not be required. So I wouldn't say there's a perfect alignment, and the state laws aren't really clear on what they mean when they say you have to be certified. But when they say you have to be certified, and by the way, that means you need to be able to securely exchange data in accordance with national standards, we recommend focusing on those core interoperability functions like FHIR and CCDA. Sonia, anything you would?
Yeah, I would agree with that. And then I think as we mentioned with the ONC base EHR definition, where it does carve out some of those criteria such as B1, transition of care, your API criteria. I think even the direct project is part of that in terms of capabilities to exchange health information is a good start for developers just to demonstrate that the product can exchange health information.
We had another question, which is, do we need to expand beyond the ONC definition of patient request for restrictions, the January 1, 2026 requirement, in order to meet state requirements? And if so, by when? And I guess two things that I would say on this. Number one, so for certification, the ONC requirement is the only one that needs to be met. But the state requirements, which specifically I would recommend looking certainly at California and Maryland. They have different deadlines, and I don't know those off the top of my head. I think some of them are in effect now. But they are requiring those specific functions to be in place. And some of them don't relate to the request process specifically. They're actually just requiring the segregation of certain types of data, often reproductive health related data. So that needs to be segregated now, actually, the segregation needs to be done without regard for whether the patient's requested it or not. And Sonia, I don't know if you know offhand the specific compliance dates on those, but we could get back to the questioner about that.
Yeah, we'll have to get back to them. Don't have it on top of my head.
So we have quite a few questions. Let me just, there is a question about whether the Nevada law was amended by Nevada SB 494, or if it's largely the same thing. Do you know offhand, Sonia, whether there was an amendment that affected AB 7 in Nevada?
Yeah, so I don't have the specifics in terms of what was changed. I do believe it is largely the same. I don't think that the certification requirements were impacted, but something, again, we can get back with the questioner.
There's another question about what is the best method to track state regulation changes.
Yeah, we've been doing that pretty organically. We've actually had a lot of developers who've brought those to us with questions or just seeking certification. So we've just been out exploring and just trying to track down different resources. But again, it's been a pretty organic process for us. And so we are working to compile the information that we do have to help developers to at least monitor the situations or those that have been finalized, which have been few, but still just understand what the shift in that landscape is. So something we can help, we can share the information that we've gleaned so far.
Yes, and one organization, the IAPP, I find is a good resource to look at. And Sonia, aren't we going to have some things on our customer portal relating to this also?
Right. So as we continue to find more information, we'll share that through our customer portal. So any existing client of Drummond has access to that portal. You log in and we'll be able to have that there for you. If you do need access, you can reach us at certification@drummondgroup.com and we can help you with that.
And there's there are a number of other questions that are on more specifics that we won't be able to get to today. So we will try to follow up, and feel free to reach out to either me or Sonia if you have more questions in the future. I'll be happy to try to help. This is a growing and changing area, and we recognize that it's somewhat difficult to get your arms around, and you may see these requirements coming up from customers, coming up in RFPs in different ways. So we'll continue to try to help sort of corral the disparate requirements that are coming in this area. So stay in touch, watch our portal, reach out to us if you see new things. I think it's an area where we can all collaborate to work on keeping the knowledge of the community up.
Thank you, Sonia, and thank you, Bob, for your time today, and thank you everyone for joining us. As Sonia mentioned, you can use our free decision tool in the QR code on the right-hand side of your screen, and you can register for our next webinar coming up on August 7th on ONC compliance updates for the remainder of 2025 using that QR code you see there. Hope you have a great rest of your day, and we'll see you at our next webinar.
Thank you.
Thanks, everyone.